Also joining us is our Nicole Versansky. And Nicole, James's family is dealing with sextortion and suicide, but suicide in general with teens is a big topic across the country.
Across the country and here in Ohio, it is the second leading cause of death between kids and young adults in Ohio. It is suicide. And a local county actually recently saw an increase, so they are trying to find solutions now to help immediately and also to help in the future.
The Medina County coroner deals with death nearly every day. But right now, Dr. Lisa Duranick is alarmed by the number of children and young adults taking their own lives.
They're getting younger.
How young?
13 has been my youngest so far. 13. And a straight A honor student. 13. It's just devastating.
Within a 2-week span, she had 3 suicides, all under the age of 21.
That was a hard week for me, because being a mom, I cry.
Compare that to 1 teen suicide all of last year in Medina County and none the year before that. So what's the reason behind that increase? There are people working to find that answer, but more importantly, working to find solutions to help. Meet Gail Hawk.
Statistics show that someone who has a family member that has died by suicide is at higher risk to complete suicide themselves.
Gail is part of the LOSS team, local outreach to suicide survivors. She goes immediately to the homes, to the scenes where someone has committed suicide, providing support to families, but also connecting them to resources for grief counseling and long-term treatment.
Well, one of the things that we've learned is that we can't wait too long. We've got to start earlier in the schools, and we have to not wait until high school. We need to be in the elementary, the middle schools. So I think those prevention efforts need to start very early on.
And that is where Devin Althen comes in. She's a prevention specialist in Medina County, working closely with schools.
Children are far more willing to talk about mental health and things that they're struggling with than any generation in the past has ever been.
And that, Devin says, provides a big opportunity to let kids be part of the solution. Some schools have designated Hope Squads, specific student teams trained to listen to their peers and to know what to do in a crisis. There are lessons and projects highlighting warning signs of suicide and information on how to help.
I'm afraid my friend is going to do this because of things they said. Where do we then send them? So being able to empower them to not only have the conversations but know how to manage them wisely is really what we're trying to do.
Do you think what you're doing is working? And tell me why.
Yeah, so when I first started here about 5 years ago, one of the things that we really focused on was youth suicides, and we did see a decrease in numbers for many years. The students were able to get the help that they needed. We're hoping that if we continue those efforts, then we are able to see those numbers continue to decrease.
1 suicide is too many. And Devin says in Medina County, they will continue to work as a team to turn those numbers around and to ultimately save lives.
I've seen the people who have gotten to the other side. I've seen the people who were struggling and didn't know where to turn to. And they found that one glimmer of hope. And they were able to then get their life back.
Wow.
And this is just a small glimpse of potential solutions here. And we are committed at 19 News to continuing to dig into potential solutions to be able to help our kids. We've done stories in the past on the importance of school intervention, counselors in the school systems, and then the challenges of shortages of workers in the mental health field, how to come up with ways to attract more people to be able to help our kids who are struggling right now with some mental health issues.